So guys, this video is reacting on a patient who's had a transplant and is giving us 5 things that we should avoid after a transplant. Let's have a look.
Not allowed to do after a hair transplant, or it just won't work. First up, no alcohol. So for 1 week before and 38 days after, you're not allowed to touch.
Yeah, so no alcohol. We usually say to patients no alcohol and no smoking for at least 48 hours prior to the surgery and at least for the first week to 2 weeks after surgery. And the main reason for that is just so that their blood pressure and their heart rate doesn't jump up prior to the surgery. So when we get patients in, they are not at an increased risk of bleeding. And the same principle applies for after the surgery, because the incisions haven't had a chance to fully close and there is a risk that they might start to bleed, which could push the grafts back up.
Booze at all, so you have to be very good. I'm happy enough, so I won't have to have the fear for a month. Secondly, you have to avoid the sunshine. So I don't know how I'm going to manage that when I'm living in Bali, but...
So sunshine, yeah, try and avoid direct sunlight. We always say this to patients because the heat from the direct sunlight can actually cause the grafts to dehydrate. So the washing and the spraying, super important.
Thirdly, no exercising or sweating. I would like to say that this will be a struggle for me, but it's going to be a breeze. So no running, no going to the gym, no swimming. You're actually not allowed to go in the sea, so no swimming anyway. Fourth thing is...
So yeah, in terms of exercise, you can return back to mild to moderate exercise, which is usually after about 2 weeks. And then you can go back into more strenuous exercise, especially if you're weightlifting and compound training, back after about 3 to 4 weeks after the surgery.
Fourth thing is no sexy time. So for at least a week, you have to avoid jumping in the sack with someone. That doesn't mean you have to stop sexy time on your own, though. Fifth one is no.
So with sex or any sort of sexual activity, we always say it's mainly due to you not having to sweat too much. And that goes back to the previous principle. And also because of your blood pressure going up.
No smoking. See if you like those wee cancer sticks, cut them out. I've actually lost my craving to vapes, which I am buzzing about.
It's funny he says that because a lot of patients actually tell me after having a hair transplant, they've actually stopped or slowed down their amount of intake for cigarette smoking or vaping. So it's always a good idea, because of the smoking will always cause lack of oxygenation go into all of different parts of the body, and vaping is not far from that. So yeah, if you are a smoker, try and minimize before and stop 48 hours before, and try and minimize afterwards as well if you want to get a good amount of oxygen to your scalp. So in short guys, there are a lot of post-op instructions to follow, all of them being self-explanatory. However, 5 things that he's mentioned is probably the 5 most common things that people and patients ask about. So please follow the guidance as we have given it to you on the surgery day itself.